When do you need to first enroll in Medicare to avoid late enrollment penalties? There are two different components of Medicare penalties we will cover to better help you avoid them. The first is the Medicare Part B late enrollment penalty, and the second is the Health Savings Account, HSA, tax penalty. We begin with how to avoid the Medicare Part B late enrollment penalty. Generally, you're first eligible to sign up for Part A and Part B starting 3 months before you turn 65 and ending 3 months after the month you turn 65. That's all there is to avoid the late enrollment penalty. However, there are some circumstances we'll cover in a moment allowing you to enroll later. How much is the late enrollment penalty for Part B? If you didn't get Part B when you're first eligible, your monthly premium may go up 10% for each 12-month period you could have had Part B, but didn't sign up. In most cases, you'll have to pay this penalty each time you pay your premiums, for as long as you have Part B. And the penalty increases the longer you go without Part B coverage. Ouch! What if you have health insurance offered through your employer? Do you have to sign up for Medicare Part B while you're still working? Well, that depends. To best answer this question and avoid being penalized for a Part B late enrollment, you first have to know if your employer has 20 or more employees enrolled in a company health plan. If your employer has 20 or more employees enrolled in the company health plan, you do not have to sign up for Medicare while you are still working. You must sign up for Part B within 8 months after you or your spouse stop working if you're covered under a company health plan with 20 or more employees enrolled. What if my employer has less than 20 employees on the health plan? We first recommend to check with your employer about signing up for Medicare when you first become eligible. Since your company has less than 20 employees, your job-based coverage might not pay for health services if you don't have Part A and Part B. If this turns out to be the case, you'll be assessed with a Part B late enrollment penalty if you do not enroll when you first become eligible. What is the Health Savings Account penalty, and how can you avoid it? To avoid a tax penalty, you and your employer should stop contributing to your HSA at least 6 months before you apply for Medicare. This is because if you're 65 or older, your Part A coverage will start up to 6 months back from the date you sign up for Medicare or apply for benefits from Social Security or the Railroad Retirement Board. You're not eligible to make contributions to your HSA after you have Medicare. If your Medicare Part A coverage overlaps when you made contributions, you'll have to pay a tax penalty. You can withdraw money from your HSA after your Medicare coverage starts to help pay your share of costs, like deductibles, premiums, coinsurance, or copayments. So, now you know what major late enrollment penalties are for Medicare. If you're ready to shop for a Medicare plan now, get started by calling Newport Benefits Insurance Solutions at 949-258-9338. Newport Benefits Insurance Solutions is your trusted health broker.